Well, thank you, everyone. I'd like to open the floor up for some questions. I know we've got some people forming new small businesses here in the audience. If you'd like to come and ask questions, we've got 2 microphones. Clearly an excellent panel, so please, any questions?
Hi, I wanted to know, because there are different models, obviously, and I actually went through most of the I-Corps program last year. It was very nice. But really, that was focused on a very high amount of development up front, and then commercialization as a eventuality of that. But my model doesn't really fit that. It's very different. It's incremental, and we're starting to make money. How much is that actually a reasonable model for SBIR funding? Like, I'm not sure if I'm phrasing that quite right. Essentially, how much do you know in terms of what the SBIR funding committees are looking for in terms of what is the time course to become sort of self-sustaining, or, I mean, it seems like the model is very much front-centered, big investment, and then big outcome at the end.
So I can offer an initial comment. I think I understand what you're asking. So in terms of SBIR grants, I mean, one of the things that I learned very early on is that it needs to be a problem and a product. I mean, that's the vision. The state of the company is somewhat secondary. It's really, that's a box that I think the reviewers check, like, are you viable? I mean, if they give you the money, can you do the work? But it doesn't necessarily matter whether you have a lot of investment behind you or no investment. I mean, we didn't have any when we first did it, but we waved our hands, tried to look like at least we had some idea of how we would proceed if we got the money. If you're talking about a long-term project, I think the challenge, if you have a series of incremental steps, is there any way to package those as discrete projects and products that could then be licensed or commercialized in some way, even if it's part of a longer track record. I think the guys working in therapeutics face this all the time.
Yeah, I mean, hello. Yeah, I mean, I think your point about that the SBIR program is predominantly for large, risky upfront investments that will then pay off in either an acquisition or a pharma, like on the therapeutic side, so a pharma strategic partnership. I think that is true. I think they're looking to catalyze those things that have no other form of investment. If you have revenue, if you're able to generate revenue immediately, that's fantastic. I wish I could generate revenue. Some of the smaller groups, or not small, but some of the other groups that have that ability, that allows you to go through these long 9-month waiting processes when you're waiting from submission to getting funding to keep the lights on and actually keep the work going. You can actually go on to the NIAID website, Infectious Disease Institute out of NIH, and their model for the SBIRs is that you submit the phase 1 and you have money to do the work immediately, so that when you get funded 9 months later, you submit your phase 2 within 3 months. That's the NIAID. That never works that way, but that's what they would hope for. So having revenue up front is great, and if you can do it, it opens up a lot of things. But you're right, predominantly these are large, risky projects that they're going to look for a large outcome. And you just have to merge the two together. All of this is just like if you're writing grants and it's all grantsmanship. I write many things. Few of them will probably end up being reality.
Well, I don't have as much experience writing SBIR grants, but with the NSF that I won, it was really just about the phase 1 and the phase 2 for sure wasn't going to be enough money to get it to commercialization, but describing in your proposal how you're going to get that funding, or you're going to start generating products, or you're going to start making, who are the strategic partners that you're going to meet that can jump on board and start giving you that funding. So you have to have that plan outlined very well in your proposal, some sort of plan outlined that's feasible, whether or not it actually happens that way, right? But that you've actually thought of a clear path to get there.
And in general, I think at least my impression and when I review grants as well, is very quickly reviewers decide whether they like it or not. And once they decide they like it, they look for more reasons to keep liking it. And if they decide they don't like it, they look for reasons to kill it. So they'll believe you if you just tell them, here's my plan. They're not going to be critical, or if they're critical of the plan going forward, then you've already lost them, and oh well.
Yeah, so it's really technology dependent. So in our case at NOVA, we would have a product at the end of a phase 2. So we would generate revenue. So it's really very technology dependent, I think.
Yeah, just real quick to that point, from the therapeutic side, it's interesting to have to use these words like commercialization and whatnot, because we have no chance of having a product after $3 or $4 million of funding. We're going to talk even the hundreds of millions to do a therapeutic. But the people who review the grants know that, and in your specific field, they'll know what you're looking for. And so as long as you have, so in commercialization, really mean what's the next step to getting towards the market. Sometimes you get hung up on language.
Hi. Yeah, so my question is, to what degree does, if a company already has some funding, is the grant reviewers going to look at that company differently than a company that doesn't have any funding at all? So company A has already some angel funding, company B has nothing, all things being equal. Will company B be favored over company A?
I think, at least in NIH, there never is that kind of A or B sort of direct comparison. I mean, things are reviewed independently, so I don't think it matters. I think as long as there is a belief that the work could be done, if they like the project, they like the project, and that's what's reviewed as the project. The company is just there as, again, almost a checkbox. Can they execute? So I don't think there would be prejudice one way or the other.
So a company could be flush with cash, which isn't a problem I have yet, but a company could have plenty of cash, identify an interesting area or an offshoot that they want to kind of separate and really look at and maybe fund that project, and that's not looked at any differently than any other.
I wouldn't think so.
Just
don't brag about having $100 million.
For small businesses, as long as you're under the 500 cap limit as a small business, the idea is to get money out into the communities and take on these risky projects and to fund projects.
500 cap limit?
If you have more than, you can't have more than 500 employees and be considered a small business. Okay. But kind of the flip side to your question is, how is a company with no money going to be viewed? As long as you can get onto the paper, and these are relatively short applications, as long as you can get onto the paper that you have access to the resources and the facilities to do it, you should really, they're not going to ask you, well, what was your revenue or what was your balance sheet in the last year? A company who's received angel funding might be able to present themselves as more able to do it. They have a nice facility or X, Y, and Z. But if you have no money, as long as you can show that you have access once you get money, then it usually is relatively apples to apples at that point.
And actually, for people here, I think almost every grant I put in, I have a UCSD subcontract. Now, UCSD may not know about that, but I make sure at least to have a collaborator or somebody, because then in the facilities and equipment, I can say, in VR UCSD collaborations, I'm also faculty, so I have a leg up there.
And that's to back up your ability to execute.
Yeah. I list all the facilities that, because outside people can use UCSD facilities,
right,
so you can list, you can go crazy there. So at least it's not a blank page with, we have an office.
Okay. All right. Thank you.
And to the academic subaward part, for especially, grad students, postdocs, fellows, if you're on the MD side, coming out, the questions to be, can you do this? You've never been a PI before. Can you actually do this? Putting on a senior PI as an academic subaward is the way to go. You have to have someone on there to make it look like it's working. Same thing if you're a faculty member trying to get a group out and you're going to take your postdoc and say, hey, why don't you go run with this? You have to be on that as the subaward as well, because they're going to look at your postdoc as, well, this guy has no experience, because I know a lot of senior faculty wants to stay in. So this academic subaward for your early phase ones is really critical until you've established yourself out there.
So I'll get a list of those sub-awards afterwards, okay? No, only kidding.
I've stopped doing it now, I got smart.
I have two questions. One is around facilities. How much of the award can actually be used to build the facilities to do the work, or do you have to have all of the facilities in place in order to get the award, the chicken and egg kind of thing? And my second question was actually, you said you had a number of comments in terms of it takes 9 months to get one of these things if you get funded, right? And I remember that was an issue as well. It's just not the time frame you're working on, right? So what kind of alternatives are you looking at? Is it angels? Is it research foundations? That kind of stuff.
So I can say the one advantage I had was that I was faculty here, so I had a day job and I could write and not have to form the company until we knew we were going to get the award. What we actually did is the moment we got a fundable score, we went out and were introduced to our first angel investor, and basically were able to say, look, we know this is going to be funded, but it's going to take another 3 to 6 months for the money to show up. Would you essentially front us the money or make an investment that matches that so that we can do the work ahead of time, so that when the money comes, we've already done the work. And you can pre-spend on grants, was it 3 months?
Yeah, 90 days.
Yeah, 90 days you can actually start accruing costs that you then charge to the grant when the money comes in. So once you're confident it's going to come in, you can even accrue those costs. Now you have to have the means to do that. But so I think a mixture of angel and SBIR is a great way to sort of prime the pump. Academics all know you pretty much always write the grant for the work you've already done, and you need to be one grant ahead because you can't live waiting for the next one to come in. So with SBIRs, we were lucky in that we were able to fire off a bunch of different ideas to different centers. So we had 6 phase 1s over the course of 2 years. But if you can't do that, I don't know how he does it.
Well, since you pointed at me, yeah. So I mean, I did very similar with what Robin did. With a lot of consulting, coming right out. You got 9 months to sit around. You can go track down clients in town and start consulting and just keeping the lights on, essentially. If you have a product that you can sell quickly, even if it's like on a research level, or go to your former lab mates and say, hey, do you want to use my new reagent or whatever you're creating, to just keep the lights on, anything to do it. Directly to your question, I don't think any of the money can be used to build a facility. If you go into like the arcane regulations of SBIR budgeting, but that being said, much of it can be used to outfit a facility. Let's say, still regulations on what you can use in that. But so yeah, you have to access, and there's plenty of space up in town. For the bio people, just go to Mira Mesa and sublet from someone. There's plenty of space to get actual facilities.
I think what I did, because I didn't, when I got the grant award, when I was applying for it, I didn't have any space. I was working from home. I did some of the experiments in my PB apartment kitchen sink. So putting in the grant that, I had plans of, as soon as I get the grant, I'm going to go out and buy the facilities and the tools that I need. And by doing the consulting work, I did IP consulting work, I was able to save that money and use that to buy the equipment, and then keep the grant on what I had said I was going to do with the grant. So, you end up working and keeping your money in your business, but that's what you're doing. You're building a business, right? So it's an investment.
Yeah. So definitely you can't put money for facilities, but in our case, because we had product sales, that's kind of how we were able to keep ourselves. So the two kind of helped each other. When we didn't have grants, we had sales. When we did have sales, we had grants, right? But I guess for facilities, I mean, that kind of factors into your indirect costs somehow. Mm-hmm. And different agencies have different ways of looking at it. So for DOD and DOE, you need to have some kind of an approved rate. So you will get audited. I'm sure you get audited. It's not necessarily a bad thing, because once you get audited, then you have a rate that's approved by the government, and you could just use that for other proposals in the future.
Yeah, and the one bias I think certainly NIH reviewers have is they hate to fund equipment. So putting a big line item, because again, it's a 6-month phase 1 project. They don't want you buying a $50,000 piece of equipment that doesn't carry over to the other projects. So here you can rent equipment, or if you have a buddy that has it, you can set up a deal. So learning how to launder your indirects in ways that still fit the legality of it is a trick.
All right.
So in continuing with that, we're looking at the first phase of our development is doing a software simulation. So primarily, there are 2 ways of looking at that. One is you can rent the software or purchase the software. And we're only looking at software as a software simulation of the system. Have you any experience in that area?
How much is the software to buy?
About 150.
1,000?
Yes.
Rent it.
Yeah, you can rent some space. Because I mean, what institute are you looking at, or what? Sorry, what agency?
Well, DOE.
DOE. Oh, yeah. I'm not familiar with how high DOE will go, but I don't believe they'll go much higher than the hard cap, 225. And so yeah, you give a lot up doing it then, so you have to rent it or something.
And have you seen as a deliverable only as a software simulation for phase 1?
I personally have not, but phase 1 is all about feasibility. That's all you're trying to show. So if by doing the software simulation you show feasibility for phase 2 and you can convince someone of that, then you'll be good to go.
I think it depends on what you're simulating. Because in our case, some of our phase 1s, we had to simulate like a detector performance or, an integrated chip performance. But we always breadboarded on the side, so I'm not sure what you're trying to simulate.
So if we did some type of rudimentary prototype to see if it agrees with the simulation, that would come a step further.
It's whatever you need to do to convince the reviewers, again, feasibility. That's all you're doing. If you can get by with just a simulation and you can convince them that you need $500,000 to do the prototype in phase 2, then you can do that. We all do it, and academics do it, and we do it. Try not to propose too much more than the budget, because here, if you over budget, if you under budget, you're firing people. A little less so in academia, although obviously it happens. Just convince them. Say, this is the money I need to do it. NIH is pretty good. They have a pretty high cap, so we just got a 2-year, $700,000 phase 1. So that's much higher than your 150 statutory cap. So they're ready to give you the money to do the project. So you just have to talk with your PO and see if they have the money to give you, if you need more.
Thank you.
There's been a lot of talk about high risk, high reward. What's a high enough reward in your experience?
Who's viewing the reward? Is this from the reviewer standpoint or me as the entrepreneur?
From a reviewer standpoint.
Viewer standpoint.
Entrepreneurs, for us, it's always, we believe that there's a high enough reward, but.
Well, I think you got to think about how much money you're going to be asking for them. If you get a phase 1 and a phase 2 and a phase 2B, they're a couple $1 million in, not just funding that they're giving you, but not including all the program officers and all that stuff. So you need to have generated enough jobs and funding coming into your company to justify that expenditure.
What about impact to society or the market? Is it? That's really what I'm after.
This, at least in my experience, even with R21s at the academic side, they always say high risk, high reward, but the reality is, if it's risky, the reviewers will kill you. So I would say high sex appeal is more important than the risk per se. So it has to be something interesting that captures them. We got funded for things that technically were actually very boring and just work, but we found a unique problem that was interesting that no one was addressing. So I think if you try to pitch something that is really out there, you have to get real lucky that 3 reviewers all get excited about it and don't find then all the risky reasons to think that it might not work.
For reward, from the NIH perspective, is relatively simple to discover, because they have pretty extensive, their SBIR omnibus solicitation is pretty extensive in the technologies they're looking for, and that kind of highlights the impact or the reward that you have to demonstrate you're going to get to. And so that's a little easier to find. But for NIH, it's usually making a huge impact on human health. You have to promise, just like in academia, at the end of every paper, you have to promise to cure something. And so that's kind of where you end up. What the product looks like at the end, I think, Brad, your product, where you're going to end up is very different from where you started.
Yeah, that's another problem.
Yeah. And so, again, that gets kind of into grantsmanship. But from NIH perspective, pick your human health project or problem. And then, as Brad mentioned earlier, it's problem and product. What's the problem and what product are you going to make?
And the letters of support are really important for that. So if you're curing cancer, it's not hard to explain why it's important. But if you are dealing with kind of a niche area, but let's say it's some aspect of therapy that's really important to a group of doctors. I mean, if you can have then a doctor write saying, you know, this is a really big problem for the 5 of us that treat this weird disease or that give this drug this way. I mean, if you can narrow it down and say why it's really, you know, important to someone, it doesn't have to be always global, and document that. Because again, if the reviewers are with you, they're going to want to like it and look at a letter that go, oh, look, this really is important and would have impact.
Yeah, in our case, high reward was associated with a problem that was obviously of high impact post 9/11. So we developed some imagers that helped decrease the number of false negatives and false positives for baggage scanning. So, you know, you have to find something high impact like that.
Thank you very much for your comments. So we've heard from Victoria about a successful exit from one of these SBIR, STTR funded companies. And I just wanted to ask the question, in your experience, you know, what's your outlook? I mean, certainly this is a great funding mechanism, and I encourage everybody to explore it, certainly. But when you look at, you know, 5 years down the road, 10, 3, what's your horizon? Where are your hopes? And where do you see your companies going? And also tied to this, are the chances of success for an exit tied to additional funding that you require or not from angels or others?
Sure. Yeah, I guess, so where I see my company in 5 years, I do continue to see us writing grants over the next couple years. I'm hopeful that the technology that we have right now, that we've developed under the grant, will start generating licensing income, and then we can slowly sort of wean ourselves off of the government. That would be nice. There's a lot of rules that come with SBIR grants and hoops you have to jump through, and being able to have funding coming in where I can have a set R&D budget and go after different products and things like that without having to do grant work would be great. So that's where I see my company going.
Yeah, I'm sick of writing grants. So we just had a phase 2 that didn't get reviewed well, so maybe I'm just in a bad mood. We'll hear about another one next week, so maybe my mood will be different. But I mean, free money's free money, so it's great. But the timelines, I think, are, as I said before, are brutal and are not consistent with really growing a company quickly. So I think to the extent that, you know, we talk about phase 1 and phase 2 in grants. In a company, you talk about value inflection points. So when those things align nicely, it's great. You know, if you need $1 million to get from here to there, and then the company's going to be more valuable, and you can raise, you know, the next round, I think it makes sense. But for us, we're doing an angel round now that we hope will get us through the year and to our Series A. And at that point, you know, maybe we write grants when we think we have a cool idea that will be the next company. But I hope in 4 years not to be here.
Yeah, no, I guess my point was that, you know, the fact that you guys have SBIR funding, STTR funding, makes you a more attractive investment opportunity for other sources of funds.
Yeah, actually, I think that's one of the most powerful things about SBIR is just the credibility. Because, you know, everyone says their science works, and most investors, I mean, unless they're, you know, sophisticated VCs, can't do the real scientific diligence. So it does give a stamp that, okay, some smart people have looked at this project, and it's not total BS. Now, with that said, they fund some total BS too. So.
Yeah, I would say I probably see myself kind of always continuing to write federal grants. I mean, even if I were to get a you know, phase 1 or a strategic partnership, those come with relatively constrained milestones. In other words, your investors want you to get to the clinic with a therapeutic, or they want you to do your next phase clinical trial. And so the SBIRs and the non-dilutive funding will always allow you to take on new projects. That's just kind of the way that we think about it. What other questions are we answering?
At what point should you stop writing grants and focus?
Well, we've had that specific question we've had from day one, so the answer is we're not going to. But yeah, I would say the idea of it being a multiplier for investing is definitely true. I mean, you know, people are always excited to see you've raised money in SBIRs. Once you cross the $1 million mark, everyone gets even more excited. We were recently meeting with a family office from China, and during the meeting, the guy pulled up the NIH report and was like, "Oh, look, you guys have 6 NIH grants for this one company we're working with," and that went a long way even there. So it's definitely we'll use our DoD term, definitely a force multiplier in your ability to go out and raise additional funds.
Well, I've stopped writing grants, so all I can say is persevere. You can get somewhere with these.
I submitted a phase 1 NSF in December. Should I expect to hear something before the next due date, which I think is June? And if not, should I tweak the proposal and submit another?
I think, I had heard, mine was, I think that I think they moved the phase 1 date. It used to be in November when you submitted, and then you'd hear in May. So it's probably pushed. You probably won't hear about it until June, unless they speed it up.
Right. And that's when the next due date is. So.
Right.
So to your question of tweaking it, putting in with another one pending.
So we have a software platform that could go in 15 different product routes, and we're doing that in different verticals. So it's submit a different product with the same platform.
Yeah, submit all 15. I mean, as many as you can get, because it's with grants, it's shots on goal. You can have a great grant, and reviewer gets up on the wrong side of the bed, and you're done. Yep. So just keep submitting. From the NIH perspective, they almost always get them back before the turnover. So we will lightly edit and then heavily edit once you see the comments. Because resubmissions, you just give the reviewer what they want, right? Just very verbatim. But if you're not going to see reviews in time, just tweak it as you can and keep getting shots on goal.
Thanks.
I'd like to preface by saying I'm a complete rookie to this space, so if you could keep your responses undergrad, that'd be cool.
Okay.
Undergrad level. So we're working on a social startup that's designing a physical product which offers medical benefits to developing countries. So I was wondering, are there separate opportunities or funds available for products being launched in developing markets, for a social good?
I guess I'll throw it to our gentleman here. Does USAID have an SBIR program?
They don't have an SBIR program.
But they do have a grant program.
They have a grant program?
But,
okay.
There are several research foundations that can be. Okay, thanks. There are several research foundations that can be of some help. USAID and several United Nations. HOW also, Bill and Melinda Gates, and the list goes on. If you haven't done it already, depending upon where your research space is, what the indications are that you're looking at and so forth, see if you can find specialty foundations as well. For example, in my past life, to support SBIR, I have also been funded by multiple sclerosis for one venture, by leukemia, lymphoma society for others, and so forth. So the list goes on. So there are numerous other opportunities. By the way, there's another area that none of us have spoken with, and that I promise I'll shut up and hand it back to the experts and so forth, is that the lion's share of my funding, by the way, SBIR is your new seed funds. Don't look for private equity. I mean, it's going to be very, very difficult to do that. But another area that we have not spoken about, but I would also encourage you to consider in concert with SBIR or corporate funds. The lion's share of a lot of the work that I've done in launching ventures successfully is to reach out to one or two corporations for first rights relationship, and so forth. And I've had several who have written checks, open up bank accounts for me and so forth, as long as they have first access and first rights for competitive reasons for a short time. So there are numerous opportunities above and beyond SBIR. So don't hesitate to look into those as well.
So a little more to your point, someone correct me if this is wrong, because I'm kind of making this up here. But one of the major focuses of SBIRs, for instance, is that all the work is done in the U.S. They want you to hire, it's U.S. government money. They want you to hire people in the U.S., do the work in the U.S. I don't know how well they reviewed a product that would not be used in the U.S. would be. I've never seen an explicit restriction, but there's a lot of focus on U.S. government money going to creating jobs and technologies in the U.S. That being said, I don't know what the technology is, but if you could somehow, if it's like a mobile health type, is it mobile health? Let's just say.
We can say that, sure.
Okay. If it's a mobile health type thing and you can spin it to any sort of other sort of product, you might take a chance at it. For this idea, you just call the program officer, tell them what you want to do, and they'll tell you whether to apply or not.
Yeah, and you probably should look for like specific RFAs, because I know NIH even has some specific programs for adapting. Like I know there's a cancer program for moving technologies into low-cost settings. There's a specific program in partnership with Turkey. I know because we have a collaborator in Turkey that we were looking at. So you may get lucky, and there may be something specific that you could fall under. So there is a growing sense of that at NIH, but still the emphasis is on the U.S.
But Taylor touched on an important point. All federal grants have this BIDOL requirement on it, which is if you're going to sell something, in the U.S., it should be substantially manufactured in the U.S. So if your product, even if your product's target is outside of the U.S., but you intend to sell it in the U.S. as well, then you're going to run into that requirement.
There is a box about, is the research all being done in the U.S.? And I've asked because we had an international collaborator, and they said, please don't check that box. Yeah. They didn't tell me what would happen if I checked that box, but when they tell you don't check the box, I don't check the box.
Thank you.
Thank you for your comments so far. And following up on the importance of shots on goal, could you comment on a strategy, I guess, to focus on one agency and multiple topics within that, or to try and look at different agencies and submitting that way?
So I have a quick comment, which is at NIH at least, you want to be very careful about the exact study section your proposals are going to go to. You never want to be competing with yourself. So I think spreading them around to different study sections in different centers, funding centers, is generally a good idea if you can do it. And you have to understand, at least at NIH, the review is not done by the centers. The Center for Scientific Review is umbrella on top, and then they then give the scores to the individual agencies. So you can't just assume that because it's, one time it's cancer and one time it's autoimmunity, it could still end up at the same study section if the technology is the same. So you have to, but you can request the study section, and you'll see where it's headed before it's reviewed. And if you don't like that, you can beg them to change it. So
we essentially repurposed every single idea that we had for various agencies. So it really depends on how well you can do that and your bandwidth. So if you can do it, you're creative, you know how to repurpose it for different agencies, and have at it.
Yeah, I mean, if it's flexible enough. So in the therapeutic space, I can't really go anywhere other than NIH. So to Brad's point, I think we've put a max of like 2 in at a time to a study section. Because again, like you said, you don't want to compete with yourself. And if you kind of just are spamming the study review sections, they will notice. But that being said, yeah, every cycle, unless you have too much money, every cycle you want to put two or three in. I would say a minimum, provided you have the team to write them. You need to have, I would say, 2 full grant submissions is the max that a team can do. Now, if you start 10 weeks early, like you're supposed to, you can do plenty, but you're going to start 2 weeks like the rest of us, and it's going to take time. So,
I just to provide sort of an opposite point there. The funding that I had, the area that I went into was a CMP polishing process, and NSF had gotten burned a couple times from other companies that had submitted for phase 1 grants, and they companies that have gotten 14 or 15 grants in this area of CMP slurries and have no commercial products. And so when I submitted my grant, they basically said, that's all, we're going to fund 1 and that's it. And they, you have a bunch of when you get an NSF grant, there's a whole lot of supplemental funding that you can go after that'll you can do in lieu of writing other phase 1 grants. And they sort of, NSF is sort of encouraged doing that. If you have a technology that you just have slightly different variations of that technology, they'll encourage going after supplemental funding instead of actually writing more phase 1 grants. And so that's what I was able to do.
So Robin brings up an interesting point with kind of technology or idea burnout, I think is an interesting point. So, I mean, we have to remember the program officers are, we like to think that they're just kind of, autonomous machines that are reviewing all technology for it, is it going to work or not? But, they're people with bosses. And if they keep going up with programs and ideas that they're not commercializing anything, they're going to start to pull away from certain ideas. And you'll even see it in their RFAs. DoD a couple years ago said, we do not want any neuroregeneration technologies, which makes no sense because that would be useful, you could have it, but they've been burned pretty heavily in the early to mid-2000s, and all they wanted was rehab type stuff. So again, important why you always talk to your program officer. No use wasting your time on this agency or this PO or this funding cycle if they say, we're not doing CMP slurries this time. Right. So again, highlights, it just highlights talk to your program officer early and often.
Just going to say we've got time for one last question, but if you do have any questions, the UCSD team here will be available afterwards during the networking session for any questions you've got, whether you're from UCSD or the local community, SDSU, very welcome to talk to myself or Ruben, Paul, Victoria, Denise, and so on. So please do ask questions. One last question. Thank you.
With the limited amount of funding for phase 1 and somewhat limited for phase 2, and when you're writing them all in the early stage, you're kind of limited on cash. What's your suggestion on hiring people, buying equipment, buying materials, and how to balance all that with indirect costs?
Tricky.
Be creative. Consultants, don't commit to hiring full-time employees, or if you do, be very honest with it. Every one of our employees first worked for us as a consultant, just so that we could mesh and make sure they understood, what they were getting themselves into. And I think you have to be transparent with the people that are going to be funded by them. That should motivate them as well, but it's tough. I don't know that there's a single answer.
Yeah, with equipment and facilities, just lease, beg, borrow, and steal. I think we have an entire storage locker full of Forma. Like when Biogen left town a couple of years ago, we just raided everything they had. So be creative there. On the hiring front, I think that's a critical mistake that I made in my first spin out. That kind of Brad mentions is you really want to go the consultant route. You give people jobs and they start thinking of, they have families and all this other stuff, and you start laying them off. No one wants to be in that position. So personally, I like to give someone a year contract. So I'm going to hire someone. Otherwise, stick to consultants. And then use your equity to bring some buddies on and do the sweat equity route, and put your 18-hour days in and go that way. Try not to hire too much, because it is limited funding. If you get a 3-year phase 2, do what you need to do. But I think that'd be a critical mistake that I think I made, was bringing on too many employees and not enough consultants.
Yeah, we did the same thing. We had a lot of contractors and consultants.
At what stage do you suggest moving from the contractors to real hires? Years later on?
As soon as you can afford
Whenever you have enough money.
Like I said, my rule is a year. If I can give you a full year with decent benefits and an equity compensation plan, because we're still a startup. Wow. Only a couple percent here. Then I'd offer. Then I'd offer actually employment. Let's say.
Sure.
I think for me, it's been, I didn't hire my first employee until I got the phase 2 grant. And then at that time it was finding the perfect employee for the position, not the perfect employee. So you don't want to go out and hire the biggest and the best and the brightest. If you're going to have, I needed somebody to help take lab work off my plate. And so hiring a lab technician to come in, and that saves, you can get lab technicians right now for $15-20 an hour that have bachelor's, master's degrees. In the area, so I did the same thing as hiring them on as sort of 6-month contractors at first, and then you can sort of if they're good ones or not, if you can keep them, and then you can bring them on full time. But I think that's a key is hiring the perfect employee for the position and not trying to find the biggest and the best and the brightest out there.
I think the one overall comment I would make is it kind of depends on what kind of company you're trying to build. There's certainly a lot of people. My executive chairman always asks people, do you want to be rich or do you want to be king? And I think there's a lot of people that build SBIR companies that want to be king, and so they want to run a little, just keep it going, living grant to grant, and that's fine. But if you are trying to be rich and trying to go explosive, entrepreneurial kind of growth, then you may at some point just have to find people and say, this is the ride. We've got 3 months worth of money, and we'll try to get it. Maybe we'll get a grant. Maybe we'll raise it and go for it. Because I think that's the one. If you let the grants slow you down, they can. And we went through a period of that where it was just like all we were doing was writing grants. And yes, it's great. It's non-dilutive, but at some point, no, let's go for real and take the risk and make sure everyone's comfortable with that. But that's why I like it as seed funding. Get the prime the pump, but then build something else.
Thank you.
Awesome. Well, thank you so much. I'm the only thing standing between you and the refreshments, so I'll make this brief. I'd like to thank the organisers and Ramesh for hosting us in this fabulous institute. This is a wonderful facility. Please do hang around for some networking. We have some feedback slips, which we'd really appreciate you completing. Let us know. Give us your contact details as well. And most importantly, I'd like to thank our panelists and speakers for a fantastic event. So thank you very much.